But no, it is not month 13 of 2020. We have actually transitioned into 2021, and we're really excited about that. And we're really excited. Joe is gonna do the introductions today and close the meeting out for me. I have to drop off a little bit early, but I did want to say that we're excited. We are going to try this year to put out, like we did during the summer of last year, quarterly. Our sessions will be quarterly announcements, so we can people can plan ahead of time to be a part of it, and we can share earlier. And so we do know for the rest of the this quarter, we're going to have the new director with WHQR will be visiting with us, and we will have the new director with WDI will be with us, Holly Chow. So that will be the rest of this quarter. And if you have suggestions of anything that you think we should bring to our African American Business Council to share, please let us know. We would love to ensure that we're bringing quality programming each month to you. And so we're excited today. Joe is gonna do the introductions, and then we're gonna hear from the team from New Hanover Regional Medical Center. They will open it up for Q&A, and then at the very end, we'll have announcements. So if you have any announcements, please share them then, or drop them in the chat, and they can be shared out that way. So I'm going to stop talking now and turn it over to Joe.
Thank you, Tracy. I'm really super excited about this year as well. Definitely excited that I get to have two colleagues with me today joining the African American Business Council. I'm also glad that this is being recorded. These two experts, I don't know if they would give themselves that title, but I definitely would, around the COVID-19 vaccine, which I know we have very, very many folks in our community that are wanting some answers to those questions. These two folks who I'm about to introduce have been going around to our employees answering those questions, because our employees are really healthcare workers as well. Their families, their neighbors are tapping into them, asking them about the vaccine. So we want to make sure that they have the information, as well as our employees have asked pretty important questions too from a healthcare standpoint, because they're on the front lines. So without any further ado, I'm going to go ahead and just read their bios, because I was really super impressed with what I was able to read. I learned a little bit more about them. The first is going to be Tony, is that correct? Okay. Tony is a current resident of our pharmacy group. She's in her second year, ambulatory care pharmacy resident, obviously at NHRMC. She obtained her bachelor's degree in general biology from the University of Maryland. Go Terrapins, anyway, College Park. And then went on to obtain her doctorate in pharmacology, or Doctor of Pharmacy degree, at the University of North Carolina, Chapel Hill. She completed her first year of pharmacy residency also at New Hanover Regional Medical Center. So we get to keep her twice, which is outstanding. And she's been just amazing, just absolutely amazing. And then holds a special place in my heart is Lisa Edgerton. And she's also been a warrior in the health equity space, tackling me back in September of 2007, just wanting to get more actively involved. But Lisa is a pharmacist as well, holds her doctorate, obviously, in pharmacology as well. She works for NHRMC, where she has worked since 2003. She beat me by 4 years. Lisa graduated from Campbell University of Pharmacy and Health Science and completed a residency at Cone Health in Greensboro, North Carolina. Lisa practiced as a clinical pharmacist practitioner, managing patients with chronic disease within NHRMC Family Medicine for 15 years before transitioning to assist New Hanover Regional Medical Center health system with broader initiatives such as employee volunteerism, community outreach, and safe opioid prescribing. Those take-back programs, Lisa is kind of involved in a lot of that, getting these opioids off the street, families bringing them in for loved ones that no longer need them. Wow, she's been at the helm of this whole thing. Lisa also currently the Pharmacy President Program Director for the PGY2, or the second-year residence for ambulatory care residency, and as well as residency coordinator for the 4 pharmacy resident programs at NHRMC. So she's got nothing to do, which is why she's able to come today and help us out to understand. So I'm actually going to turn it over to them. We'd love to have questions. When appropriate, you can type them into the chat, or when invited, you can take yourselves off mute, just ask questions. This is your time to ask any specific questions of Lisa and Tommy. So I'm going to turn it over to these two ladies to take it.
Thanks, Joe. First of all, we are so happy to be here. It is such an honor to get to speak to you all, and we know your audience as well. And so we really appreciate this opportunity. What's worked well, and as Joe mentioned earlier, is we just like to give you some information that we know about the vaccine, also some information that we don't know about the vaccine, because we think it's important for you to know what questions we still have that are unanswered. So what has worked well is Tommy will give a 15 or 20 minute discussion about the vaccine, and then we'll open it up for questions. And if there are no questions, which I'm guessing there will be, but we also can share some questions that other groups that we've gone around and spoke to have asked. So we have lots of things that questions that have come up that may be on your mind and you may not feel like asking. So we'll share with you the questions that other groups have asked. And as Joe said, if you want to write something down and type it out in the chat box, we can answer it that way as well. And sometimes that's easy for people to do so they don't forget their question. So feel free to do that. I'm going to turn it over to Tommy, and then we'll pause at about 15 or 20 minutes and open up the floor for questions.
All right, thanks, Lisa. So like Lisa said, I'll start with my first 15 to 20 minute spiel about the vaccines, general information that we know or don't know about the vaccine. So I'll go ahead and jump in. As you guys know, back in December last year, so December 11th, 2020, the FDA issued an emergency use authorization for the Pfizer-BioNTech vaccine. And that was specifically for individuals 16 years and older. And then a few days later, really December 18th of 2020, the FDA issued EUA, so emergency use authorization for the Moderna vaccine. And that was in individuals 18 years of age and older. So what exactly is an emergency use authorization? I think this question comes up because one thing that's kind of unique about this vaccine and the development process for this vaccine is the fact that it was able to kind of go through faster channels to become available to the public because of the nature of the COVID virus, because of the fact that it is a pandemic and it is affecting a lot of things right now. So an emergency use authorization is a method that the FDA uses to help make certain medical products like medications or vaccines in this case, to help make them available quickly during an emergency. So the FDA uses the best available evidence that they have without waiting for all the evidence that would be needed for the FDA full approval. They will carefully balance the potential risks and benefits of the product just based on the data available. And then for an EUA request to be approved by the FDA, they have to determine that the potential benefits of the vaccine, in this case, outweighs the known and potential risks of the vaccine. Keep in mind, the EUA can be revoked or revised at any time as more and more data comes out. So it's important to note that the vaccine still goes through the rigorous testing for safety and efficacy, and that EUA or emergency use authorization does not compromise that. One of the other things that we like to also talk about in the beginning is the mechanism of action, or exactly how the vaccine works. So the COVID vaccines, both of them, the Pfizer and the Moderna vaccines, are mRNA vaccines. So the M in that mRNA stands for messenger. And the mRNA vaccine sends a message to our cells to make the spike protein that's on the virus. So what that spike protein is what the virus normally uses to enter our cells. So think about it as like a key that you use to get into a room, for example. So this is something that the virus just has on it to get into our cells. So that mRNA vaccine is going to tell our cells to make that key. Our body is going to see that key and think, oh, this is different. So it's going to produce antibodies to fight off or destroy that key. Now, once that process is over, the body destroys that mRNA, it kind of goes away, but those antibodies that were produced stay in our antibodies. So if we're ever exposed to the virus again, we already have those antibodies in our body to fight the infection. So it's important to note that the mRNA vaccine itself does not include the virus. So you're not giving the virus, or it's not a live form of the virus at all. So the vaccine itself cannot actually cause an infection to happen. So in terms of the number of doses, it is 2 doses for both the Pfizer and the Moderna vaccines. These doses are going to be given intramuscularly, which just means into the muscle in the upper arm. And the intervals are different for both vaccines. So the Pfizer vaccine is given 21 days apart, and then the Moderna vaccine is given 28 days apart. For both vaccines, there's a grace period of 2 days either before or after that 21 or 28 days is up. And now, if that grace period is missed, things happen. There's no need to start the series over. The CDC recommends that you just continue and go ahead and get that second shot as soon as possible. In terms of efficacy, both the Pfizer and the Moderna vaccines were found to be about 95% effective at preventing the COVID infection. And that Pfizer vaccine was found to be 95% effective 7 days after that second dose, while the Moderna vaccine was found to be 95% effective 14 days after that second dose. So it's important to keep in mind that even after getting that second dose, there's still that 7 to 14-day period before we actually have full protection from the virus. Another important thing to talk about that a lot of people have had on their minds is the side effects that this vaccine can cause. So the most common side effects that people have reported are things like injection site pain, so soreness in the arm that you receive it in, some fatigue, some headache, muscle or joint pain, and then very rarely, but sometimes people do report fevers. And this is usually, those side effects are usually more common after the second dose of the vaccine. And those symptoms should really only last about 24 to 48 hours, so about 1 to 2 days after the shots. And I think it's important to note that those side effects that we're experiencing are actually a sign that our immune system is responding exactly the way we want it to. So that kind of tells us that it's doing its job, and it's creating those antibodies that we're going to need to fight off the virus if we're ever exposed to it. So the use of things like acetaminophen or ibuprofen are perfectly fine to help manage those side effects. Right now, though, the CDC doesn't recommend that we pre-medicate before we get the vaccine, just because theoretically it could blunt the response and so decrease the amount of antibodies. This is a theoretical risk, but they are saying that after you've gotten the vaccine, if you do experience any of those side effects, it's perfectly okay to take some acetaminophen or some ibuprofen. Another thing to mention about those side effects is after the vaccine is given, we're monitoring people for 15 minutes afterwards at the very least, and just kind of watching them for any kind of side effects, any kind of anaphylactic reactions. And then for those who have had any kind of severe allergic reactions in the past to either any vaccines or any injectable medications, we're actually monitoring them for 30 minutes after the vaccine is given. So keeping an extra eye on those people.
And Tammy, I just want to jump in and make sure everyone knows the anaphylaxis is really when you have facial swelling, tongue swelling, throat swelling, if you will. It's extremely rare. So when we say that word, I want to make sure people know what that is, but it's very uncommon and you should not see that.
Absolutely. The CDC recently published some information kind of detailing how often that anaphylactic or severe allergic reaction is happening. So this information was from between December 14 and December 23rd, so around that 10-day period. During that 10-day period, they had given about 1.8 vaccines so far out to the public, or to healthcare professionals at that time, I think was the phase that we were in at that time.
1.8 million?
1.8 million. Yes. Sorry, did I say 1,000? 1.8 million. Yes.
You just said 1.8. I just wanted to make sure the million.
1.8 million, yes. So a lot of people. Now, out of that 1.8 million, 21 cases of that anaphylactic or severe allergic reaction were reported. So if you do the percentage on that, that's 0.001% of people had that anaphylactic reaction. And then out of those 21 cases, 71% of them occurred within 15 minutes of getting the vaccine. And then 17 out of 21 of them had already had allergies or allergic reactions to other vaccines in the past. 7 out of 21 of them had a history of prior anaphylaxis. So the reason why I'm throwing these numbers out there is just to kind of emphasize the fact that it is very rare for it to occur. And we are monitoring for 15 to 30 minutes afterwards to keep an eye on that. So if it does occur, it most likely will be caught. Let's see. So in terms of long-term side effects, so that's another question that a lot of people have is, yes, we're seeing these side effects immediately after, but what's going to happen, months, years after this? But since we only have months of follow-up really since these studies began around the summer of 2020, we don't know of any long-term side effects at this point. But I want us to also remember that long-term side effects for any vaccines really are very, very rare. But data is being reported right now to it's called the Vaccine Adverse Event Reporting System, or VAERS. And that's going to help us gather any kind of long-term data that's coming out as well. And then the CDC also has its own smartphone-based tool called VSafe, where people can report any day-to-day side effects that they experience. And so in that way too, we're gathering data about short and long-term side effects. And VSafe also actually reminds you of that 21-day mark and reminds you when to go get that second shot. So another really cool feature on that smartphone-based tool. I wanted to talk a little bit about distribution of the vaccine. So the shipment of the vaccines are, of course, being coordinated by the federal government, and then the vaccines are sent to different states based on their populations. The way that the vaccines are being allocated and the policies for that kind of differ from state to state. But here in North Carolina, it's been broken down into 5 main groups. So group 1 is healthcare workers and long-term care staff and residents. So that's specifically healthcare workers with in-person patient contact. And then long-term care staff and residents are people in skilled nursing facilities, adult care homes, and then continuing care retirement communities. And then group 2, which is also one of the people that we're vaccinating right now, is older adults. So anyone 65 years or older. And that's regardless of any kind of health status or living situation. So those are the 2 groups right now that are being vaccinated. And then group 3, so the next set of people that it'll be opened up to would be frontline essential workers. And the CDC defines those as people that work in transportation, food services, finance, like bank tellers, legal, media, public safety, public health workers. So the CDC kind of has a list of who these essential workers are. Then group 4 after that will be adults that are at high risk for exposure and increased risk of severe illness. So anyone 16 to 64 years of age with high risk medical conditions, anyone who is incarcerated or living in other close group living settings, and then any essential workers that have not yet been vaccinated. And then group 5 is the last group, and that's anyone who wants a safe and effective COVID-19 vaccine. So there are these groups. Right now we're in group 1 and 2, and then we're going to keep progressing through those groups as vaccines become more and more available. The other thing that I wanted to highlight were some high-risk population groups that we would strongly recommend that they get the vaccine, just because the virus itself places them at increased risk. They're at high risk of getting the virus itself, but also they're at higher risk of being hospitalized or even dying from the virus. Now, these are patients who have comorbidities. The CDC lists things like cancer, COPD, serious heart conditions, sickle cell disease, and type 2 diabetes, among others, as comorbidities that kind of increase the risk of having a severe COVID virus infection. And then race and ethnicity also can place certain populations at increased risk of getting the virus or being hospitalized or dying from the virus as well. So the CDC actually has a breakdown of kind of incidences or frequencies of the COVID vaccine in different virus in different populations. And they, on their website, they have that African Americans are 1.4 times more likely to actually get COVID-19, and then 3.7 times more likely to be hospitalized from it, and 2.8 times more likely to die from it. And that's compared to white non-Hispanic people. And then Latinx people are 1.7 times more likely to contract it, 4.1 times more likely to be hospitalized from it, and 2.8 times more likely to die from it. And then Native Americans and Alaskan Natives are 1.8 times more likely to get it, 4 times more likely to be hospitalized from it, and then 2.6 times more likely to die from it. So higher risk in these populations, so an even more important reason to get the vaccine and try to get protected as soon as possible. I wanted to highlight too that the studies that that have helped bring the Pfizer vaccine and the Moderna, their EUA, included patients in these populations. So the Pfizer vaccine had 26% Latinx people, 10% African American people, 4% Asian people. And then Moderna study had 20% Latinx people, 10% African American people, and 4% Asian people. So I think it's important to know that these studies also included those populations, and there were no significant differences in the effectiveness of the vaccine from one ethnicity or race to the other. That benefit was found across the board. So those are the things I wanted to highlight really quickly. And then at this time, we'll take any questions that you guys have about the vaccine.
So I'm going to ask a question right out of the gate. If I get the vaccine, do I have to worry about, and I complete the cycle. So if I take the Pfizer vaccine, if I heard you correctly, there's only 21 days between dose 1 and dose 2. Moderna is 28 days. Either way, I've taken the vaccine. Is it okay for me to take my mask off and you know, I'm immune supposedly. So can you speak a little bit to that?
That's a really good question. So it is going to still be important to make sure to continue to wear masks, wash hands, stay away from crowds, practice social distancing, all of those things, even after you've gotten the complete series of the vaccine. And that's because, like I mentioned earlier, first and foremost, you don't have full protection until about 7 to 14 days after that second dose. And then even after that, we do not have enough data to say that people who have the vaccine are not still able to carry the virus and potentially can still spread the virus. So we don't have enough data to say that people who have gotten the vaccine cannot spread the virus, if that makes sense. So I think it's important to think about the vaccine as just one of the tools in our toolbox for managing this pandemic. So one amazing analogy that we heard about was patients with diabetes, for example. There are kind of different prongs to the management of diabetes. There's medications, there's diet, there's exercise. So usually we are recommending that people do all 3 of those things to help fully manage the diabetes. So doing 1 out of those 3 may not fully help manage the diabetes. So the vaccine is just 1 out of all our tools to kind of help protect yourself and others from getting the virus as well.
And I'll add to that, Joe. That's a really good question. And you all may have heard a little bit about the variants that are coming out or the mutations of the virus. And I'll let Tony speak to that just a little bit. But I think that's another reason it's important to wear the mask, because the vaccine only covers what we know right now. And as more variations, more mutations of this virus comes out, it may not cover every one of those strains. And that's common. Think about the flu shot. It's about 60, probably 65% on average each year able to cover the strains that are out there. This is going to be very similar over time. And I'll let Tony speak to that just a little bit.
Absolutely, yes. So I know with the variants that have been coming out, it has, caused a little bit of a fluster around, wait, we finally think we have a little handle on this, and now there's more things coming out. I think it's important to know that the COVID-19 virus is just like any other virus. It mutates. That's just what viruses do. So it's not unexpected that this is happening. Right now, I know I read a little bit about, I think for some of the variances that are coming out, they might be spread a little quicker than the ones that we had before, but there is no data to suggest that they're more severe or more fatal than the one that we already have. And in terms of whether or not the vaccine that we have right now covers those variances, so that's something that we're still kind of figuring out as we go. But again, there's no data right now that says that the vaccine that we have does not cover those variances. So I think more information about that will come out over time.
So we do have a question in the chat. And this comes from Michelle, and she's asking, I'm in group 5, the last group to be vaccinated. How long will it take, in New Hanover County for group 5 to get appointments to be available? Is that the summer or later? When is a time frame that she can kind of expect group 5 would be approved for vaccination?
As far as I know, I don't believe that we have like a projected time frame for that right now. I believe that the plan is to do as much as we can in each group before we move on to the next. Just given the fact that those group 1, group 2, group 3 are, higher risk of contracting the virus. So I think that it's hard to pick a month or pick a time just in case that doesn't work out. You don't want it to be the wrong month. But that information is going to come out as we go as well. So it's not information that we have access to right now, but over time we'll know more about, how long we're going to spend in each group before we move on.
And I'll just add to that, I agree 100% what Tony said. We don't know exactly, and it really is all based off of the supply of the vaccine that each location receives. So I know at New Hanover, we open up slots as soon as we know we're going to receive that vaccine. If you look backward, we spend about a little less than 4 weeks in each group. So if that's the case, then we started this in mid-December. So it may be April to May by the time we get to that fifth group. We don't know that, but we're hoping to get more vaccine released, and so that way we can put our processes in place and vaccinate more people. So worst case scenario, I would think it would be the time frame that you mentioned, Michelle, but hopefully it is shorter than that.
Natalie has her hand up and wants to ask a question as well.
Thank you, Joe. So I've heard from friends in other communities around the country that there's such a thing as a waste list where folks can get on the waste list. And at the end of the day, if you haven't used all of the vaccine that you've prepared, that you might get lucky, even if you're in group 5 and you'll get a call to come get your vaccine. Do we have anything like that in New Hanover County?
So I haven't heard it. Oh, go ahead, Lisa.
Nope, you go ahead, Tammy. Go ahead.
I was just going to say, I hadn't heard it called a waste list before. I think that's an interesting term to describe it. But I know that we're doing everything that we can to make sure we're not wasting any vaccines at the end of the day. So at the end of the day, when we've gone through our appointments, if we've opened a vial and still have some doses left over, we do everything that we can to make sure those doses are used. So we are calling people who either haven't gotten it yet or are really close to their second dose and can get that second dose. We're calling as many people as we can to try to make sure that we don't waste any doses.
And I'll just add to that, I'm proud to say that I'm aware that we have wasted no doses at New Hanover. We've been very lucky. We have such a huge staff that anytime that we have an open vial, we just walk over to one of the floors and say, who hasn't been vaccinated? And we literally pull people down. Because we haven't gotten all of our staff, those are sometimes the easiest people to get. Even some of the people running the clinic and vaccinating within the clinic, they haven't been vaccinated yet because they're not in that group of caring for COVID patients. And so a lot of times we're vaccinating those people right there in the clinic. So there's, Natalie, to answer your question, there's not an official wait list, but we are definitely utilizing all of the doses. And I think one of the practices that did this weekend, the Myrtle Grove practice that were vaccinating patients, they were able to actually call in a few very high-risk patients known in the community to come in at the end of the day.
Yeah, so the answer to your question, Natalie, just to poke a little fun, is if the clinic is going to close at 5 o'clock, get there at 4:45. If they've if they've got 5 needles on the table, you might get lucky. That's you know,
Joe,
you
we're
might.
gonna have 3,000 people at our door now.
But you know, one thing I do want to stress, we as a healthcare community cannot stress enough about setting up those appointments, and then not just setting them up, but keeping them. This is what's allowing our system, and I heard from the county this week, they haven't wasted any yet. This is what is allowing us to be so efficient and not waste vaccine, you know, because we can't put it back. I mean, these ladies will attest to it once it comes out. Go ahead, I'm not the expert. You guys comment on that.
Once we make the vaccine and mix it together with the diluent is what we call it, it's only good for, I think, 6 hours. And so at that point in time, it's wasted. So we do not make a bunch in advance. We only make enough for the scheduled appointments. And I would also agree, keep your appointments. People might be wondering, how do I get an appointment? How do I get through the system? There is a lot of stress on the system right now because so many people want to get in and get an appointment. What we know is that keep watching the new NHRMC.org website. Watch for my chart messages that you are eligible and that you can schedule appointments. They open up before we even get a chance to release it to the media and let people know they're open, and they're already filled. So everybody is searching for this, to get an appointment to get the vaccine. There are going to be more appointments coming very soon. We're planning to open up some very large clinics and extend those over the next couple of days and weeks. So there will be lots of opportunity, again, as long as we have the vaccine. It's all about having the supply.
Yeah, definitely. And just to attest to that, yesterday we released some appointments just to kind of give you perspective. So did the county, by the way. So New Hanover County Health Department released some, NHRMC released some. Within 2 hours, all the appointments were gone. I was refreshing my screen and I was watching them go that fast. So just want to back up, Lisa, with that comment. Carolyn has a question that I want to get to here, and I'll read it to you all. It says, what if there wasn't, or what if there isn't vaccine available when it's time to get the booster shot? What do we do then?
I can answer that. We've been guaranteed by the state that whatever they give us, they keep track of dose number 1 vaccines and then dose number 2 vaccines. So if we get 1,000 dose number 1 vaccines, we will get 1,000 dose number 2, and that is guaranteed by the state. So everybody that gets the first dose will be guaranteed the second dose. But I do want to plug that whatever product, and Tony mentioned earlier, if you get a Pfizer product or if you get the Moderna vaccine product, you need to stick with the same product name, the same brand, because they haven't studied the interchangeability of those, and the schedule's a little different. And so to ensure you have the most and the best immunity possible from this vaccine, you need to stick with the same product.
I heard a rumor. Go ahead, Natalie.
No, I have a question. So if you're still on that topic, go ahead.
No, I have a different question. I want you to
Okay.
have your time.
Thank you. So, I've seen that there are people who are concerned, and Tommy, I'm sorry, all of those people aren't logged in today with us so that they could have heard the way you have answered potential concerns about the vaccine. What can we do? What can the African American Business Council and or the Chamber of Commerce do to try to help ensure that people understand that there's nothing to fear? That yes, there, with every vaccine, obviously there are questions that might not get answered. But how do we help make sure people understand how much quicker we can get a handle on this pandemic if we get vaccinated?
I think it's all about just educating any chance that we get. I think, people in the community will ask us questions, will reach out to us if they think that we have more information about the vaccine. I think that it's being ready to answer those questions, whether or not people decide to get it, just being able to educate on why you chose not to or why you chose to get it. So I think it's, in educating ourselves and then being able to educate others as they, ask us those questions as well. And then I was also going to mention that Lisa and I are available to do any kind of education. If you know of any businesses or groups of people who can benefit from education around the vaccine, Lisa and I are available to do educations. We can do them in person or we can do them virtually as well. So we can be a resource for that too.
Tommy, would you extend that to include, there may be some folks that are going to watch this from New Hanover County Schools, think about our teachers, other chamber members that may want to contact you two for their businesses. I'm thinking from small businesses all the way up to the PPDs and the GEs that are out there, as well as UNCW staff. Are you all available or would make yourself available for those kinds of things?
Absolutely, yes. Everything that you said, yes.
And
we wanted people to get the facts, and I think that's so important because a lot of the information that's out there, especially on the social media, people word of mouth, there's a lot of fear, Natalie, like you said, about this vaccine. And for whatever reason, we want to turn that fear into more facts, just having the facts. And then like Tammy said, and then it's people's individual decisions whether they want to get it. But if we give facts and people can keep perpetuating facts in that way, even employees, we have some employees that don't want to get the vaccine, and at least they have the facts to educate other people, whether it's their family members or whether it's community or patients. We want people to have the reliable information.
I've heard that there are some medical staff who aren't getting it now, and this is anecdotal. Obviously, I don't have any evidence or data or quotes or anything, but that they're not getting it more because they want to make sure at-risk people get it first. And to me, that's an unsung hero. Not a surprise for those of you who choose to be in the healthcare professions that you're in, but I get that's their desire, and yet they're as at risk, in my opinion, as some of the most at risk in our population. So I hope that they're balancing their own health and ability to care for us while they are trying to be who they are, selfless. And so, but certainly helping people who literally are afraid understand is my goal.
Thank you. And I think, like Tommy said, it starts right here. I mean, the fact that you all are here, that shows us that you're interested and you want to help disseminate that knowledge. So thank you.
So we already have one group that's interested in having you all come out. Sue Meyer put on there that would they speak to my Rotary Club? I believe the answer, Sue, is yes. So we'll make sure that you get the contact information. I have one question that I heard as a rumor. I just need some confirmation, and maybe you all know. So parents of that have to take care of children with special needs, maybe in a higher risk category, are they able to get the vaccine shot early? Was there any discussion at the state level around that?
I cannot say that I've heard anything specifically about that.
I agree. I don't know specifically about parents, and I may just not have been a part of that discussion or a part of that feed. I do know that there are some other types of providers that work with patients, whether it's occupation or children, particularly like occupational therapists and other speech pathologists and different things. And I think they would just fall into the regular category that the state has designated at this time.
Okay. All right. Thank you. Well, I do know that our chair is going to have to drop off shortly. Didn't know if she had any other questions at this time, but also if any of the rest of you have any questions, please feel free to put into the chat or take yourselves off mute.
I know another question that came up in some of our groups was about interactions. So Tony, can you speak a little bit about how this vaccine, if I need to get another vaccine, if I'm up for a shingles vaccine, or anything I should know about regarding interaction with medications?
Good question. So what the CDC is recommending right now is that if you are planning to get a vaccine or have gotten another vaccine in the past and are wondering if you can get the COVID-19 vaccine, they're recommending separating those by 2 weeks. So if you get the COVID-19 vaccine right now, you want to wait 2 weeks before you get another. Or if you've gotten another vaccine, like the zoster vaccine, for example, last week, you want to wait 2 weeks until you get the COVID-19 vaccine. It's just separating by 2 weeks either way. And then I think I heard you say about interactions with medications. So right now, there are no medications that have been found to interact with this vaccine. So there are no medications that should be stayed away from, or there is no medications that will cause you to need to stay away from the vaccine itself. The only thing that they're saying is if you have had an allergic reaction to any component of the, or severe allergic reaction, so any component of the COVID-19 vaccine or any mRNA vaccine, then they're recommending not to get the vaccine, but only if you've had an allergic reaction or severe allergic reaction in the past to an mRNA vaccine. So for example, if you had an anaphylactic reaction or severe allergic reaction to the first shot, they're not recommending to get that second shot.
So here's a question. I mean, you hit on it, Tommy. What are the ingredients in each of these? I mean, you know, can I pronounce them?
I was about to say I'm going to read them out to you now, but you're going to have to forgive my pronunciation. So the Pfizer vaccine contains mRNA, of course, lipids, so it has a lipid coat around it. It contains potassium chloride, monobasic potassium phosphate, sodium chloride, dibasic phosphate, and sucrose. And one of those things that I said is PEG, or polyethylene glycol. So that's one thing that they're saying, that if you've had a severe allergic reaction to in the past, there is a chance that you could have a severe allergic reaction to the vaccine. The Moderna vaccine has similar things. So mRNA, lipids, polyethylene glycol, or PEG, DMG, or dimeristoyl cholesterol, acetic acid, sodium acetate, and sucrose. And there is a vaccine fact sheet for both the Moderna and Pfizer vaccines where you can find this information too, if you ever had to go back and refer to it.
Thank you. So 4 basic ingredients to this vaccine. 4 basic. All right. Good stuff. All right. Sue's got her hand up. She wants to ask a question. So go ahead, Ms. Sue.
Thanks. Thank you, ladies. I donate platelets on a regular basis. When my turn comes up, will I have to delay? I go probably every 2 weeks to donate platelets. Will I have to delay that?
That is a good question. It's not one that we've come across so far, so I think I might have to look a little bit into that. Nothing that I've read so far says not to donate platelets if you've gotten the COVID-19 vaccine, so I've not seen that anywhere, but I can't 100% tell you either way, so I have to look some more into that and probably get back to you.
Okay, great, thank you.
Yeah, that's a good question. That brings up a point. People do have very specific scenarios. People have asked, I have asthma, or I have a clotting disorder. Can I get the vaccine? And what we know is that in the studies, and now millions of people have received the vaccines, and probably somebody in that big pool has a similar situation, but it may not be designated on paper yet. So if you're concerned, it's just an option, it's just a consideration or recommendation, is you could skip one of your donations, just give it a little bit of extra time, kind of like treat it like you got a vaccine, and you could just skip one, then do your vaccine, maybe skip one more, and then get back on schedule. And I wouldn't see any concern about that, because that gives your body enough time on both ends sort of to clear out and to boost an immune response. That's a clinical recommendation that, again, we have no support for, just using kind of what we know about how the vaccine works.
Sure, okay, great, thank you.
Okay, any other questions for these 2 ladies?
And as you're thinking, one of the questions that comes up is, so how long does this last? Do I have to get it again? Is it forever?
Good question. So since the vaccines really have only been tested since the summer or so of 2020, we don't have information about exactly how long that protection will last. But that's again something that will be coming out as time goes by. It's something that we'll find out with time. But we know that because another question, for example, that people ask is, if I've had the COVID virus, do I still need to get the vaccine? We know that the virus itself does not offer like long-term protection. There are scenarios where people get the virus multiple times. So it's going to be important to still get the vaccine, because we know that that protection is going to be longer than just the virus itself without the vaccine, if that makes sense. But in terms of exactly how long it's going to be, if we're going to have to get it yearly or need a booster, we do not know right now, but that information will come out as time goes by.
They're studying antibodies regularly in people that have received the vaccine. And I know somebody I work with just got her antibody. She got the vaccine, both doses, completed her series, and she got some antibodies test results back in a study that she's in, and she has long-term antibodies present. So that meant that she didn't have short-term, which would be more like you had an active COVID disease or COVID complications, if you will, recently had COVID. She had long-term antibodies, which means that the vaccine was working as proof that she can potentially fight that disease off if she were to get COVID. And we were really excited. Yay. But that's all we know.
So Lisa, I saw that you gave Sue your email address in the chat box. We hope that this video will get viewed over and over on Facebook, especially in our African American Business Council section, our page there. And so can we share, is that the right thing to do, is to share your email address? I don't want you to get inundated, and yet we do want to make sure that our members have access to the answers that you all are providing to us in the event that we didn't ask a question they wanted to hear an answer.
Sure. Natalie, yes. Put my email out there. It's lisa.edgerton, EDGERTON, @NHRMC.org. And then if I can't reach all the people that may come to me, then we can farm those out. Our pharmacy department's about 200 different individuals, and so if we can't answer it or can't attend to it, me and Tony and myself, then we can always rely on our peers to help us out. So we will get somebody to you or to the person that needs some assistance. Absolutely.
You guys have a lot of thank yous in the chat, or Lisa. They just, Lisa told me everybody really thanks you for this information. I'm going to ask one more time. So last call for any Q&A or any questions that Lisa told me you want to bring up that others have asked that you think might be pertinent for this particular audience. Let's go ahead and get them out there. This has been a great session. I really, really appreciate this. And the fact that the Wilmington Chamber was willing to record it for all of the chamber members, specifically the African American Business Council, is just absolutely positively phenomenal. So
yeah, Joe, I will add something. I've got some recent data yesterday, and I'm sorry I don't have it I haven't memorized it at my fingertips, but we know their African American population is not getting vaccinated in this community. Maybe statewide, maybe countrywide, but what I care about is right now, right here. And so if there's anything that we can do to reach out to that community and help promote, answer questions, whatever we need to do, maybe it's just setting up availability. We also know our Spanish-speaking population is delayed in getting a lot of the communication. So they don't even have an option if they don't have the knowledge about where to get the vaccine, how to get the vaccine. They may qualify and not even understand that they qualify. So if there's opportunities for those two populations, particularly, if anybody out there is listening and fall into those groups, you really want to consider getting the vaccine. As Tony mentioned earlier, those populations are at much higher risk of poor outcomes, and that's death, hospitalizations, and really severe disease.
And Tommy and Lisa, I don't know if you all were aware of this, North Carolina Department of Health and Human Services has on their website. They are now beginning to track. It's typically, I would say 3 to 5, maybe even 7 days behind who is getting the vaccine. So it's age group, that's gender, that's ethnicity or race. And I will say, to your point, Lisa, thank you so much for bringing it up. African Americans are bringing up the rear. So is our Hispanic and Latino community as well. Two of the populations that obviously are not responding well to even contracting COVID-19 need to get this vaccination. And then the other thing too is the age groups. I mean, that age group from about 30 to 49, 50, right in there, is popping up with the vaccine or COVID-19 the most. But the good thing that is coming down the pike for that particular age group is kind of like they're next in line very shortly here. So thank you for bringing that up. But anyone can go to the DHHS website. You can look up that data for yourself and track it. You can see that we really need to get a more robust response from our minority communities. Well, folks, I'm going to go ahead, Lisa, you got one more thing? Go.
Yes, there's one last question in the chat. I want to make sure and get to that. The question is, what if someone has had COVID already? Do they still need to get vaccinated? So Tony, would you like to address that as our last question?
Absolutely, yes. So even if someone has had COVID in the past, it is recommended that they still go ahead and get the vaccine. I think that what they found is that when someone has had the virus, they may be protected for about 3 months or so, but after that, they're still at it's still possible to get the virus. So they're recommending that you can get the vaccine as soon as possible once you're outside of that quarantine time, as well as once the symptoms are over, then you can get the vaccine. So as soon as possible, once those two things are done. Yes.
Okay. Thank you for catching that last question. Really appreciate it. Well, folks, if we don't have anything else for these ladies, I want to thank everybody for listening and for being a part of the African American Business Council on this inauguration day. Hopefully you had your recorders going so that you could record what was going on in the DC area. So this is a huge day. I'm going to go ahead and close out the meeting if there's no other business to discuss. Appreciate every single one of you contributing. Tony, Lisa, we cannot thank you enough for being here. Thank you so much.
Thanks for having us. We appreciate it. We loved it.